Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you a little bit more about managing peripheral neuropathy through nerve reset. So, when it comes to peripheral neuropathy, there are really four ways, and these are broad categories, but four categories of how you can manage peripheral neuropathy. Number one, which is the most common used, the most common done, is nerve repression. All the nerve modifying medications like Lyrica, gabapentin, Cymbalta are designed to repress the nerve symptoms, not to fix anything. There are other things that can be done. A TENS unit, for example, is a really good option to repress, but really that most of the time the treatment options that are repressing are not doing anything to fix it. So the other three are designed to improve or fix portions of the peripheral neuropathy. Number two is repair, which is the ideal. We would want to do that. Number three is re-education, which we talked about a couple days ago, which is basically getting the brain and the nerves to talk together in the right language. And number four would be nerve reset. The easiest example I use for that is when you've got a computer that's malfunctioning and you call support, they typically say, shut off the computer, turn it back on, see if that fixes it. A lot of times it does. But this is a little bit more complicated than that. You can't just turn nerves off. What you need to do is you need to get the electrical signals so they're flowing at the right speed, at the right strength, and in the right way. And one of the things you can do is by depolarizing the nerve, by getting it so that the nerve will flow in the right direction and have enough nerve potential to actually get the level of signal to the next nerve and so forth. It is important that you completely shut it down, so you completely depolarize it so it can be repolarized again. The most effective way we found to do that is through a system called neurogenics, which actually is a form of electrical stimulation that's used with anesthetic injections. And between the two, if you do the anesthetic injections, that you lower the potential of that nerve, and then you do an electrical stimulation, what you're doing is you're allowing that nerve to depolarize and repolarize. And if you do this over a series of anywhere from 12 to 24 treatments, you start getting the point where the nerve health is improved in such a way that depolarization actually will last for a longer period of time. So you depolarize, repolarize, it starts to function like it's supposed to, and you've got, through this process, you've actually improved the health of the nerve. It's like exercising the muscles. You're exercising that nerve in such a way that it starts to function more like it's supposed to, and it becomes more and more and more effective at functioning. This is most effective. We found it to be most effective on small fiber neuropathy, although it can improve some of the other types. It really comes down to what the symptoms are and what the health of the nerve is, because this depolarization and repolarization isn't directly treating the mitochondria, isn't directly treating the nerve cell body or the axon or the dendrites. It's actually just treating the signal itself. And so if you can get the nerve healthy enough, if the nerve is healthy enough that you can do this, then it will be very effective and actually can work quite well. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 205. And the idea is to reset the nerve. Depolarize, repolarize, so it can actually function like it's supposed to. Thank you. Have a great rest of your night.